Today we're doing a video explaining how a lot of the really popular new weight loss injections work. You know it's going to be super nerdy because I've got a whiteboard, but we're going to get into some of the mechanisms of these, talk about the effectiveness and some of the potential side effects so that you can make good choices about these medications. These are obviously used to treat diabetes as well, but their biggest application right now in a lot of circles is for weight loss. So, three primary receptors that these might act on. One, GLP-1, glucagon-like polypeptide, GIP, glucose-dependent insulinotropic polypeptide, and a glucagon receptor. So, the first drug in this class, Semaglutide, acts on just this GLP-1 receptor. What happens when that receptor is acted upon is it increases insulin, so it helps to decrease blood sugars. It decreases a hormone called ghrelin that stimulates appetite. So people taking medications that act on this receptor have a decreased appetite. They have a slowed digestion because of the combination of these things. They eat less, and so they lose weight. Patients on semaglutide in clinical trials on average lost about 7% of their body weight. That can be a very significant amount for a lot of people, and a lot of people taking this medication lost more than that, but that was the average. So the second big one, really popular right now, Tirzeptide, acts on the GLP-1 and the GIP receptor. So you're getting two receptors instead of just one. These do a lot of the same things in terms of decreasing blood sugars and decreasing appetite. Tirzeptide, in the clinical trials, the average for patients taking this over about a 48-week period was a decrease of 15% of their body weight. So really significant weight reduction. It was quite a bit more effective than the semaglutide. For some patients who may get some stomach pain or some bloating or some reflux with semaglutide, anecdotally, this seems to be a little less with Tirzeptide. It seems to be a little more tolerated for some patients. So, the biggest one, newest one, still investigational at this point, has not cleared the FDA, is Retatrutide. It acts on, as you might guess, all three of these receptors, GLP-1, GIP, and glucagon. The data from the clinical trials thus far is that patients who took this over a long period of time lost on average 24% of their body weight. So for patients that really need to lose a lot of weight or really need something very, very effective, it certainly looks like Retatrutide is going to be a big hitter for them at this point. There is also another compound, Survodutide, that skips GIP and acts on GLP-1 and glucagon receptor. Because of that mechanism and because of the glucagon and how it helps to liberate glucose from the liver, this one's being looked at in treating fatty liver as well as obesity and diabetes. So not as much data yet. It's investigational also. But semaglutide, Tirzeptide, Retatrutide hitting 1, 2, and all three receptors. These are some medications that you may want to talk with your provider about and see if one of them may be an option for you.